Hello everyone, welcome to the section of cardiology. In this video vignette, this is Dr. Jaitly. I'm going to be presenting to you a very brief discussion on what is angioplasty. It's a very commonly asked question, what is PTCA, what is PCI? These are synonyms. PTCA was known for almost 20 years till it was changed to PCI. PTCA stands for Percutaneous trans-catheter angioplasty. And PCI is the same thing as percutaneous coronary intervention. So what is angioplasty? In the treatment of acute ischemia of a heart attack or an acute coronary insufficiency, a catheter is passed with a balloon attached to it, and that balloon is inserted and inflated near the region where the plaque is extremely narrowed or the artery is stenosed. And to improve the perfusion, the balloon is inflated, and that procedure is called percutaneous coronary intervention, or PCI. So these days it's customary to insert not only the balloon, but a catheter where you have a stent, and a stent is also attached to it, so that this way the stent is placed and remains in the artery as shown here in the right diagram. So usually it requires a hospitalization only for a day, but the very fact that the plaques that have formed, now let's look at it on the left side of the panel, the plaques that have formed over the years, and the artery gets to be stenosed, so the arterial flow to the supplying distal tissue, which is the myocardium in this case, or the heart muscle, that suffers a great deal of oxygen supply rather abruptly. And therefore it is in jeopardy or is at risk to undergo a heart attack. So an unstable angina where the plaque ruptures or an acute thrombus develops, like in a setting of a heart attack, a catheter, like we move into the right panel here, a catheter is immediately inserted while in the cath lab. The patient is fully awake, and the artery and the catheter is found via the femoral or even via the brachial, which is in the arm. And as the catheter is advanced through into the artery, while the balloon is deflated, the stenosis is determined that this is the area where the stent ultimately will be deployed. And at that point, the balloon is inflated very cautiously. When the balloon is inflated, this results. What happens is, the blue being the margin of the plaque that is now totally compressed against the arterial wall. Look at here. The blue was the plaque and green is the deflated balloon along with the stent. And this is where the rupture occurred. The red is the rupture of the plaque or the acute thrombus I'm trying to show here in this artery. So now, once the catheter is and the stent is passed through it, the balloon gets inflated. And once the balloon gets inflated, the plaque is displaced, so that now it is juxtapositioned only to the arterial wall, and the lumen is restored, so that now the arterial flow can occur freely to the compromised heart muscle tissue. Now here you see the flow was very, very minimal, as I've shown in lighter arrows. Here now the flow is restored, and at that point the this catheter is pulled back and the stent is left in place. The green is the stent, which now keeps the plaque from re-happening, and therefore it stays open, and therefore restenosis is prevented or minimized. So once again, a catheter is advanced into the artery, which is the culprit lesion, and the culprit lesion, that's the place where the catheter along with the balloon and the stent is placed in. The balloon gets inflated, the plaque is pushed against the wall, and this results, and now the balloon is pulled out while the catheter along with the stent is in place, and the stent is positioned so that it stays in position right next to where the plaque was compressed from. and now the catheter is pulled out and the stent stays in permanently. So with the result that the artery is rendered open while the plaque was pushed against the wall. Now this is followed later by obviously antiplatelet agents, because the patient will have to remain on antiplatelet agents like aspirin and clopidogrel, or a combination of similar agents. So this way, indefinitely, the stent can stay open. Of course, other modalities like anti-cholesterol agents and beta blockers and ACE or ARB inhibitors, and along with the very stringent diet, which is low fat and zero cholesterol diet, has to be maintained. Of course, patient is required not to smoke if he has had history of smoking prior to this plaque treatment. So the main indications now, once again, for angioplasty are now divided into 3 categories. One is acute MI or heart attack within a few hours. 2 is unstable angina or acute coronary insufficiency. And 3, when you cannot do a coronary artery bypass surgery. When you cannot perform an acute CABG or coronary artery bypass surgery, then obviously you can only do an angioplasty in those cases. So an acute heart attack, an acute coronary insufficiency, and when surgery cannot be performed, then PCI is indicated or angioplasty is indicated. I hope you found this vignette very, very interesting. It's very fascinating to me always whenever I look at the various treatment modalities in a setting of acute ischemia. We'll be discussing more details at a later vignette. Stay tuned. Thank you for your attention.